Normal delivery or cesarean birth? Which is better for the women of today? Now, before I begin this, I'll tell you two stories. The first story is about this lady who was 42 years old at that time. Now, this was her first pregnancy, but she had a past history of endometriosis. She was struggling to get pregnant. She even attempted IVF and failed. And one fine day, she just conceived naturally. Fortunately for all of us, the pregnancy journey was very smooth. However, considering her age, considering her past history of endometriosis and her struggle to get pregnant, we both decided that we will go for a planned cesarean birth for her. We had decided on the date just about a week before her planned date for cesarean. She was coming down to see me, and she was actually driving with her sister beside her. As soon as she parked the car in the clinic, down the clinic, and she gave the keys to the valet, she told that I'm not feeling very easy, very comfortable, so please get a wheelchair for me. That was arranged, and she was brought to my clinic room. I saw her a little distressed, and I started examining her immediately. And you know what I find? The baby was almost ready to come out. Over the next 1 or 2 hours maybe, she delivered a completely healthy baby, and the baby is absolutely doing fine even few years after the birth. Now, coming to the second story. This story is about a lady who was 32 years old. She was an athlete. She used to practice about 4 to 6 hours of athletics before her pregnancy. She conceived naturally. Her pregnancy was absolutely going smooth. She was continuing her practice, not as intently as before, but she was very active during the whole pregnancy. Throughout the pregnancy, she must have gained only about 8 kilos of weight, and she had not an inch of extra fat around the tummy or elsewhere in the body. She started labor pains naturally after the baby was full term, and she was progressing very well. Everything was absolutely favorable for a normal delivery. Now, midway into her labor, she started progressing very slowly. The labor would not progress. She would not dilate. The baby would not come down. So we were keeping a watch on her, and suddenly the baby's heartbeat started to drop with every contraction or with every pain that she was having. So we had to rush her up for a C-section. Of course, she gave birth to a healthy baby by a C-section, and both mother and baby are doing fine. So where we were expecting a completely smooth normal delivery, we ended up in having a C-section. And where we thought that the chances for normal delivery is very slim, we ended up having a perfectly normal delivery. So the end point for both the mothers were the same: a healthy baby from a healthy mother. Now, that's the only target to be achieved when giving birth. There should be no unnecessary cesarean sections, and there should be no heroic vaginal deliveries. Both of them can cause complications either in the mother or in the baby, or both. Now, believe me, that's a decision best taken by your gynecologist. Over the several months that you see her, both of you should develop that trust towards each other, trust over each other, a trust that she will communicate everything that goes on with you during your pregnancy and during your labor, and a trust that you will never doubt or challenge his or her decision at any point of time. Just remember a few things. A normal delivery is always a trial. No one can guarantee a normal delivery unless a healthy baby is born vaginally. 2. A normal delivery is the preferred mode of delivery only if there is no medical reason against it. Number 3, a caesarean birth is always done to save the life of the mother or baby or both. Number 4, the labor pain has to be very strong to have a baby delivered vaginally. Now you can choose to have an epidural analgesia, you can choose to have other forms of analgesia, but the maternal efforts has to be the maximum while pushing the baby out. Whereas in a caesarean birth, the maternal efforts is minimum at the time of the delivery. However, the pain post-delivery is significant, is really distressing, and it takes almost 24 hours to settle down. 6. In the first week after delivery, the caesarean birth will have a slower recovery, but the second week onwards, both normal delivery and caesarean birth delivery is almost the same in terms of recovery. 7. Both the types of delivery will have the same 6 weeks time for a full recovery from pregnancy. And both the types of delivery will have the same breastfeeding pattern, the same vaginal discharge, and the same vaginal dryness. Number 8, you need to abstain from sex or penetrative sexual intercourse for at least 6 weeks following either a normal delivery or a caesarean birth. Number 9, if you had a normal delivery, the chances that you will have a normal delivery in your second child during your second childbirth is higher, however not guaranteed. Similarly, if you have a caesarean birth in the first pregnancy, the chances that you will have a caesarean birth in your next pregnancy is higher, but not always. Long term, multiple caesarean births have more complications in the pregnancy as well as during caesarean sections, and multiple vaginal deliveries also have the increased risk of bleeding during pregnancy and umbilical cord accidents. As I said earlier, be prepared for a vaginal delivery, prepare yourself for a vaginal delivery, but please do not close your minds towards a caesarean birth. Remember, the end point has to be a healthy baby from a healthy mother. You can write to me at drsudeshnacares@gmail.com.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.